This is a critical moment for the BMA and the profession as we ask doctors whether they want to take industrial action for the first time since 1975. This presentation will provide a recap of the proposed changes to the NHS pension scheme, the BMA's plans for industrial action, the balloting timetable and the next steps. So, why are we here? The government is making major changes to NHS pensions. Doctors' pension contributions have already risen in April and are set to rise to 14.5% of pay by 2014. The normal pension age will increase in line with the state pension age to 68. All doctors will move to a new career average revalued earnings or care scheme. For hospital doctors, this means a move away from a final salary scheme. GPs already have care pensions. The administrations in Northern Ireland and Scotland are also considering major changes to their separate pension schemes. The changes go back on the 2008 cost-sharing agreement that ensured the NHS pension scheme is fair, affordable and sustainable for taxpayers and staff. In 2008, doctors accepted higher and tiered contributions for all and a higher retirement age for new entrants. We agreed to changes that gave staff, not employers, sole responsibility for covering future increases in costs. The NHS scheme is currently providing £2 billion a year to the Treasury. Furthermore, doctors will have to pay proportionately more for the same pensions as some other public sector workers, up to 14.5% of their pay, compared to 7.5% for a senior civil servant on a similar salary. In January, we surveyed members about the government's offer. It was overwhelmingly rejected. We are continuing to lobby hard, but so far the UK government has refused to come back to the table. In response to the profession's huge strength of feeling, BMA Council decided it had been left with no choice but to ballot the BMA membership on industrial action. The ballot will open on May 14th and close on May 29th. The action must legally start within 4 weeks of the ballot closing, and employers must be given at least 7 days' notice beforehand. The ballot is a postal ballot only and should be posted by Friday, May 25th, in time for the May 29th deadline. The model of industrial action that the BMA is proposing is urgent and emergency care only. It has been devised to have impact and ensure that patient safety is not compromised. Doctors scheduled to go into work would go to their usual places of work to do some of their usual duties, but they would not undertake consultations or procedures that could be safely postponed. These would be postponed as far as possible in advance. The initial action would be for a 24-hour period. We would plan for a series of actions, but we would review the impact of each one, especially on patients, before deciding next steps. Patient safety is the clear priority. We are continuing to rule out a complete withdrawal of labour, what is normally understood as a strike. Doctors scheduled to go into work would go to their usual places of work and would provide all urgent and emergency care. We are emphasising the need for advanced planning and coordination. If doctors were in any doubt about the safety of postponing the care of an individual, the advice would be to treat. There is not an exhaustive list of what care should and should not be provided. However, here are some examples of the sort of work that could be safely postponed. Routine appointments in primary care. Administrative work that is not urgent. Non-urgent outpatient appointments. Non-urgent elective surgery. Management meetings, unless they are concerned with immediate patient care or about the industrial action. Interviews for recruitment and exams should be postponed in advance if possible. Detailed guidance for GPs, hospital doctors, public health and occupational health physicians is available on the BMA website. Planning will be critical to the success of the action. Plans will be different depending on where you work. It is important that all members, particularly those on BMA committees, encourage their colleagues to get informed and vote. In hospitals, BMA Industrial Relations Officers will help coordinate action locally by working with local negotiating committees. Planning will involve liaison with managers to help them to make plans to safeguard patient safety. GPs should discuss the industrial action with their colleagues and, if possible, agree the extent of the service provided on the day of action with their primary care organisation. Salaried GPs and locums taking industrial action should respond to the questions asked by their practice to help plan services on the day of action. Doctors have not taken industrial action since 1975, and so this area of law is untested. As such, to protect the BMA and its members, we will have to ask 2 questions on the ballot paper. 1. Are you prepared to take part in industrial action short of a strike? 2. Are you prepared to take part in a strike? The planned action is not what is normally understood to be strike action. However, if members want to take the industrial action outlined by the BMA, they should vote yes to both questions. Legally, it could be considered strike action, which is why we are asking the 2 questions. But the BMA will not ask you to completely withdraw labour. We will not be balloting certain groups of doctors. We will be helping these members to show their support in other ways. We want the highest possible turnout to give the BMA a clear mandate for industrial action. We believe a mandate for industrial action will send a clear message from the profession to the government that a fairer way forward should be found. Members should vote yes to both questions on the ballot paper in order to give the BMA that mandate. It is important to know how you could be affected by the industrial action before you make your decision. The law permits your employer to withhold some or all of your pay on the day of action, and in general practice, some payments from primary care organisations could be withheld. As far as indemnity arrangements go, the Medical Protection Society has advised us that indemnity arrangements would remain unchanged. It is also important to recognise that industrial action does not remove the responsibility to act professionally in accordance with the GMC's good medical practice. There are a number of steps you can take in advance of any action. In hospitals, you can make contact with your local negotiating committee, and in general practice, doctors should be discussing the action with colleagues in their practice and have preliminary discussions with their primary care organisations. It is also crucial that you become advocates for the action. Tell colleagues they need to vote yes, yes to take action. Look out for the ballot pack from Monday, May 14th. The ballot pack will contain a covering letter from BMA Chairman of Council Dr Hamish Meldrum, an advice slip, key information and the ballot paper. The ballot closes at 5 p.m. on Tuesday the 29th of May. However, you must get it in the post by Friday the 25th of May in time for the deadline. Make sure you are ready to make your decision when your ballot paper arrives. The results will be made public on Wednesday the 30th of May.